All right, so our second question for you is, we know that you're the chair of the CSEP CPT subcommittee. So tell us a little bit about your role as a chair and your interest in CSEP.
So when I've been a CSEP member since I was a graduate student. We present at conferences. So it's sort of the premier research platform and society for exercise physiology in Canada. So every year there's a big conference that goes on. It brings Canadians and international researchers from all over the world together to present any new exercise physiology or related physiology research to everyone that's there. So you get to make connections with other institutions and friends, and it's kind of a great society in general. But that's sort of the research side of things. There's also the certification side of things. So it's sort of two branches of CSEP. One's really the research and promotion of research and the use of research for creating things like the 24-hour movement guidelines for Canadians and so on. So providing advice to our society based on evidence-based research. Then the other side is the certification side. So the two main certifications are certified personal trainer and certified exercise professionals. And those two certifications need a group of volunteers which work in those areas to help design things like the exams, monitor the progress of things, make decisions about how things are going to be run. And that's what the Professional Standards Program Committee does. So the Professional Standards is basically we're coming up with, or at least making edits to, we didn't design them in the first place. Committees long ago did that. They designed the certifications, and now we manage those certifications going forward. So what needs updates? What are things we can add to the certifications? So some things that have just come out, for example, are specialties in pregnancy and exercise with pregnancy. There's a new mental health one coming out soon, so that people that are certified professionals can take webinars, courses to learn more about these specific subpopulations and how to tailor exercise programs for them. But it's really about exercise testing and prescription, the whole, certification realm. So on the Professional Standards Committee, there's a chair for the CPT level, the CEP level, and then there's also a person that goes to the board of CSEP, which is all of the main committees for CSEP have someone on the board, and they help with the academic side, the membership side, the certification side, and so on. So there's multiple different layers to CSEP. Communications, equity, and diversity. So there's membership in all those different types of committees. So it's all by volunteer. So it's always professionals and academics from across Canada that volunteer their time to be on these committees. And because I teach 3LO3, which is exercise testing and prescription, I really wanted to get involved with CSEP so that I could be on the ground floor helping to make some of the decisions about the certifications and the progress of the certification. So basically, my role as chair on the CPT committee is to make decisions about the exams for the CPT. So we create the practical exam. We create the theory exam as a committee. We edit and monitor the questions over time. We make changes and alterations as the content of the path changes, which is another committee that works on the path. And there's another committee that works on, things like scope of practice and so on. So all of these decisions are being made by different committees across the board. And then the technical subcommittees are involved in making all the alterations to the tests and exams and things like that along the way. And then, anything that we want to do or implement at our level moves its way up through the ladder of the society. So we start at the CPT subcommittee where we're doing all of the CPT specific work. And then I bring what we're doing to the Professional Standards Committee, which is all of the certifications and the decisions about all of them. And then from there, they bring it to the board, and the board decides, okay, these are good changes, you can do them. So it's just a tiered level of how these things work. But being on the CPT committee is valuable because I know what's going to be happening with those certifications before they happen. So for me, I've been on this committee for several years, and it's super super important for keeping 3L up to date and as current as possible, because many of the things that we're changing, other people not involved in CSEP wouldn't know they were even happening yet. So I get in on the ground floor and I can get the students, on board with these changes before they even happen. So it's nice that way. And then part of what I do, because I work on the exams and other components of the committee, that we deal with the certification side of things. I also went and became an instructor examiner at CSEP. So basically, it's like me getting my CPT certification, except I also have to get a much higher mark on the exams, and I need to go through training on how to teach it as well. So I got that. I think the second year I started teaching 3L, which was actually 4MM at the time, was the course code. And I got that instructor examiner certification through CSEP so that I could certify students after the course was done. So that was just an extra thing I decided to do because I thought this will make it interesting for students, that they don't have to go elsewhere to get certified if they choose to get certified. And I'll prepare them really, really well for all of the exams in the course as well. So it's giving them the option, right? Many students in kin are not interested in necessarily becoming personal trainers, but the fact is that option's always there for you. And even if, 4 years down the line, you change your mind, you as a kin student, and especially if you've taken 3L, have prepared yourself really well to do those certifications. So it's sort of like having, an extra job in your back pocket that you could always utilize if you decided to.
Right. Well, that's so great. Thank you so much. And for all of you who already don't know Dr. Howarth, she puts in so much effort into making her courses really thought through, and the amount of effort that she put in getting into the CSEP subcommittee and then becoming an instructor so she can certify us is just really wonderful. The things that you do, they really warm my heart, and they make me think that I'm so lucky to have you as a professor, and I'm sure that a lot of the students feel the same way as well.
Oh,
So
thank
thank you
you.
so much for your efforts.